Welcome to the MRCS Bites session on Head and Face Anatomy and Pathology, OSCE Station 1. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. Question 1. What are the main sutures of the cranial vault and what skull bones do they separate? The cranial vault is composed of several bones joined together by sutures. The main sutures of the cranial vault and the bones they separate are coronal suture. This suture runs horizontally across the skull, separating the frontal bone from the two parietal bones. Sagittal suture. This suture runs vertically along the midline of the skull, separating the two parietal bones. Lambdoid suture. This suture runs along the back of the skull, separating the parietal bones from the occipital bone. Squamosal, squamous suture. This suture runs along the side of the skull, separating the parietal bones from the temporal bones. These sutures are fibrous joints that allow for slight movement during birth and brain growth, eventually fusing completely in adulthood. Question 2. At what ages do the fontanelles fuse? Fontanelles, commonly known as soft spots on a baby's skull, close at different ages as the skull bones fuse together. Anterior fontanelle. Located at the junction of the frontal and parietal bones, this is the largest fontanelle. It usually closes between 12 to 18 months of age, but it can sometimes take up to 24 months. Posterior fontanelle. Located at the junction of the parietal and occipital bones, this fontanelle typically closes much earlier, around 1 to 2 months of age. Sphenoidal, anterolateral fontanelles, located at the junction of the frontal, parietal, temporal, and sphenoid bones, these fontanelles usually close by 6 months of age. Mastoid, posterolateral fontanelles. Located at the junction of the parietal, occipital, and temporal bones, these fontanelles generally close by 6 to 18 months of age. These closure times can vary slightly among individuals, but generally follow this pattern. Question 3. What pathologies are associated with the improper fusion of the suture lines? Improper fusion of the suture lines in the skull can lead to various pathologies, primarily craniosynostosis. Craniosynostosis is a condition characterized by the premature fusion of one or more cranial sutures, which can affect the shape of the head and face. Premature suture fusion can also restrict the growth of the skull, leading to increased intracranial pressure, which can cause headaches, vomiting, visual disturbances, and cognitive impairments. Abnormal skull shapes can sometimes impact brain development, leading to delays in developmental milestones and cognitive challenges. Hydrocephalus is a condition where there is an accumulation of cerebrospinal fluid, on CSF, within the brain, potentially caused by restricted skull growth due to craniosynostosis. Treatment for these conditions often involves surgical intervention to correct the skull shape and allow for normal brain growth and development. Question 4. What bones make the pterion? The pterion is a region on the lateral aspect of the skull where 4 bones meet. These bones are frontal bone, parietal bone, sphenoid bone, temporal bone. Question 5. What's significance of the pterion? The pterion is clinically significant for several reasons. The pterion is the thinnest part of the lateral skull and lies directly over the anterior branch of the middle meningeal artery. Trauma to the pterion can fracture the skull and tear this artery, leading to an epidural hematoma. This type of hematoma can rapidly increase intracranial pressure, requiring prompt medical intervention. The pterion serves as an important landmark for neurosurgeons and other medical professionals. Its location is used as a reference point for surgical procedures involving the cranial cavity, such as craniotomies. Knowledge of the pterion's location is crucial in understanding the relationships and potential vulnerabilities of nearby neurovascular structures. This understanding aids in diagnosing and managing head injuries and other cranial pathologies. Question 6. What are the main parts of the sphenoid bone? The sphenoid bone is a complex bone located at the base of the skull, in front of the temporals and basilar part of the occipital bone. Body is the central part of the sphenoid bone. It contains the sphenoidal sinuses and forms part of the base of the cranial cavity. Greater wings extend laterally from the body and form part of the floor of the middle cranial fossa and the lateral wall of the skull. Lesser wings are thin, triangular projections that extend laterally from the upper part of the body. They form part of the floor of the anterior cranial fossa and the posterior part of the roof of the orbit. Pterygoid processes extend downward from the junction of the body and the greater wings. Each process consists of two plates, medial and lateral, and contributes to the formation of the pterygoid fossa. Sella turcica is a saddle-shaped depression on the superior surface of the body. It houses the pituitary gland in its hypophyseal fossa. Foramen rotundum is an opening in the greater wing that transmits the maxillary nerve, a branch of the trigeminal nerve. Foramen ovale is an opening in the greater wing that transmits the mandibular nerve, another branch of the trigeminal nerve, and the accessory meningeal artery. The sphenoid bone plays a crucial role in forming the base and sides of the skull, as well as the floors and walls of the orbits. Its various foramina and fissures allow for the passage of important nerves and blood vessels. Question 7. What are the main components of the sella turcica? The sella turcica, a saddle-shaped depression on the superior surface of the body of the sphenoid bone, has several main components. Tuberculum sellae is the anterior border of the sella turcica, which forms the posterior margin of the chiasmatic groove. Hypophyseal fossa, or also called pituitary fossa, is the central deepest part of the sella turcica, which houses the pituitary gland. Dorsum sellae is the posterior border of the sella turcica, a square-shaped bony prominence that forms the back wall of the sella turcica. Posterior clinoid processes are projections from the dorsum sellae that extend laterally and serve as points of attachment for the tentorium cerebelli, a membrane that separates the cerebellum from the inferior portion of the occipital lobes. The sella turcica is a crucial anatomical structure because it protects the pituitary gland, an important endocrine gland responsible for hormone production and regulation. Question 8. Name the bony boundaries of the anterior cranial fossa. The anterior cranial fossa is the most forward part of the cranial cavity, and its bony boundaries are formed by several bones, such as the frontal bone, ethmoid bone, and sphenoid bone. Orbital part of the frontal bone form the majority of the floor of the anterior cranial fossa. Frontal crest is a midline ridge on the internal surface. Cribriform plate is located in the midline. It contains numerous small foramina for the passage of olfactory nerve fibers. Crista galli is a vertical projection rising from the cribriform plate, serving as an attachment point for the falx cerebri, a dural membrane. Lesser wings form the posterior boundary of the anterior cranial fossa. Anterior clinoid processes are extensions of the lesser wings. The anterior cranial fossa accommodates the frontal lobes of the brain and includes several important foramina and structures for the passage of nerves and blood vessels. Question 9. Name the bony boundaries of the middle cranial fossa. The middle cranial fossa is a depression in the floor of the cranial base that houses the temporal lobes of the brain. Its bony boundaries are formed by parts of the sphenoid and temporal bones, and it extends from the posterior edge of the lesser wings of the sphenoid bone to the petrous ridge of the temporal bones. The main bony boundaries are, for anterior boundary, lesser wings of the sphenoid bone separate the anterior cranial fossa from the middle cranial fossa. Anterior clinoid processes also form the anterior boundary of the middle cranial fossa. For posterior boundary, petrous ridge of the temporal bones forms a sharp ridge that separates the middle cranial fossa from the posterior cranial fossa. Dorsum sellae of the sphenoid bone also form the posterior boundary, located posterior to the sella turcica. For lateral boundary, squamous part of the temporal bones forms the lateral walls of the middle cranial fossa. For medial boundary, the body of the sphenoid bone includes the sella turcica and its surrounding structures. The floor is formed by the greater wings of the sphenoid bone and the squamous and petrous parts of the temporal bones. The middle cranial fossa contains several important foramina and canals, including the optic canal, superior orbital fissure, foramen rotundum, foramen oval, foramen spinosum, and foramen lacerum, which transmit crucial nerves and blood vessels. Question 10. Name the bony boundaries of the posterior cranial fossa. The posterior cranial fossa is the deepest and most posterior part of the cranial cavity, housing the cerebellum, pons, and medulla oblongata. Its bony boundaries are formed by the occipital bone, the temporal bones, and a small part of the sphenoid bone. For anterior boundary, dorsum celli of the sphenoid bone forms the anterior boundary of the posterior cranial fossa and the posterior wall of the sella turcica. Clivus is part of the anterior boundary and is a sloping bony surface formed by the posterior part of the sphenoid bone and the basilar part of the occipital bone, leading to the foramen magnum. For posterior boundary, internal surface of the occipital bone forms the posterior wall of the posterior cranial fossa. For lateral boundaries, petrous part of the temporal bones forms the anterolateral boundaries of the posterior cranial fossa. Mastoid part of the temporal bones is located posterolateral to the petrous part, forming part of the lateral boundary. The floor of the posterior cranial fossa is formed primarily by the occipital bone, including the foramen magnum, where the brainstem continues as the spinal cord. The posterior cranial fossa contains several important foramina and canals, such as the foramen magnum, jugular foramen, internal acoustic meatus, and hypoglossal canal, which transmit critical nerves and blood vessels. Question 11. What structures are in relation to the clivus, and what is the significance of the clivus? The clivus supports the brainstem, which includes the midbrain, pons, and medulla oblongata. The brainstem is crucial for transmitting information between the brain and the spinal cord, and for regulating vital functions. The basilar artery runs along the clivus. It is formed by the convergence of the two vertebral arteries and supplies blood to the brainstem, cerebellum, and posterior part of the brain. Cranial nerves such as abducens nerve, CN cere, trochlear nerve, CN ivor, emerge near the clivus. The dura mater, the tough outer meningeal layer, covers the clivus. Cerebellum is located just posterior and inferior to the clivus. The cerebellum is involved in coordination and balance. The clivus provides structural support for the brainstem, a critical region for autonomic functions such as heart rate and respiration. The basilar artery and its branches, which supply blood to essential parts of the brain, run along the clivus. Any pathology affecting the clivus, such as tumors or fractures, can impact these vessels and the blood supply to the brain. Tumors such as chordomas can develop in the clival region. These tumors can compress the brainstem and cranial nerves, leading to various neurological deficits. The clivus is also a site of concern in cases of skull base fractures, which can impact the adjacent vascular and neural structures. The clivus is a key landmark in neurosurgery. Approaches to tumors and other lesions in the posterior cranial fossa often involve navigating around or through the clivus. The dura mater attaches to the clivus, helping to anchor the brain within the cranial cavity. For more MRCS Part B resources, please visit mrcsbytes.com.